Hi, I'm Chris David, Director of Marketing here at Aspira Health. And I have the pleasure of sitting down with Dr. Alexandra Cox, who is the head of the postpartum wellness program here at Aspira Health. And today we are going to talk about a topic that most men don't really know quite as much as they may think they know. But this is something for the ladies. We're going to be talking about breastfeeding. So, Dr. Alexandra Cox, enlighten me on a topic that I truly do not know much about, but have raised 2 children and have witnessed my wife embark on the journey of breastfeeding.
I think embark is and journey. I think that those are good words to describe the breastfeeding journey.
Sure.
It can be wonderful and rewarding, or it can be really, really hard, or it can be wonderful and rewarding and really hard. But I think that we all go into having a baby thinking that we're going to be able to pop the baby out and breastfeed and it's going to be perfect and, you know, it's going to be all sunshine and roses. And I don't know anybody that that's actually the case for. So breastfeeding is, I would say, at least in my own personal experience, one of the harder parts of motherhood.
Interesting.
Yeah. So it's, there's a lot of pressure from society about breastfeeding, and just we gotta feed the babies. If breastfeeding works for you, great. If it doesn't, and you want to breastfeed, reach out. I know we have contacts here at Aspira that can help with lactation and feeding, and if you decide that breastfeeding is not the way you want to go, great too. Formula is fantastic these days.
I was raised on formula.
Yes, and look how well you turned out. But we all had formula as kids, and we all turned out just fine. And one of my kids had a whole lot of breast milk, and one of my kids had a whole lot of formula. And you know what? They're both perfect. So breastfeeding can be really hard, and what I would have to say about that is if you're struggling with breastfeeding, just reach out and get some help. You can ask a pediatrician at any of the appointments that you go for the baby in the first year. You can call your OB provider as well, or you can reach out to us here at Aspira. And we have lactation consultants on call. We have a pediatrician here in the building. I am here with the postpartum program, and we can help you and we can support you, which is really important. So one of the keys to breastfeeding is to stay hydrated. You want to drink a good bit of water when you're breastfeeding. You also need to eat more because you're burning a lot of calories breastfeeding.
Sure.
And
how many more calories though?
I don't know the exact number, but it's a lot. It's something in the multi-hundred calorie range.
I think that's kind of one of the big benefits, is burning a ton of calories to get rid of some of that excess weight that some women may be experiencing.
Yeah, some women want to drop all that weight right away.
If you're into that, I mean, no judgment.
We also want you to do it at a good, healthy pace.
Right, of course.
And being healthy for yourself and the baby, that's obviously the most important thing. But yes, that is obviously a struggle. And, with my background in my research and exercise and how it plays into the postpartum period, that's actually something we can talk about here at Aspira. But I think staying hydrated is really important for breastfeeding, and staying nutritionally balanced is really important. And then we also talked about physically what it feels like to be breastfeeding. Sometimes the baby doesn't latch, and you want to talk to the pediatrician about that.
Sometimes they're really aggressive.
Yes. Sometimes they come out as sharks and they have four rows of teeth. But we have lactation consultants who are trained to help with that. So best case scenario, breastfeeding goes fine. Do I know anybody who really has gone through the best case scenario of breastfeeding? No, not really. But I know lots of healthy babies and lots of women who've made it through. And so we are trained to give you that support, and we want you to come in and get that support.
So despite what you see on social media with everybody so happy and flowery, behind that shroud could be a mother who is experiencing some level of anxiety or depression, or some severe chafing, in which case, it may be extremely unpleasant.
Absolutely, that can hurt a lot. If you're getting extreme chafing or cracks in the nipples, we absolutely want you to reach out to someone. A lactation consultant is probably the best person for that. And we, like I said, we do have one here on call at Aspira. That can be so painful, and it's something that your partner is not experiencing. So you can say it hurts, but you're sitting next to somebody who doesn't know what it actually feels
Sure.
like. So that can be very difficult, and it can make you stop breastfeeding. And if you want to stop breastfeeding, that's great, but some people it happens and they're not ready to stop breastfeeding yet. So then there's all of the guilt that comes with, I'm a woman, I'm supposed to be able to breastfeed, and turns out we aren't all cows with just milk flowing out of us.
Despite what society may have you believe.
Right. Yeah.
Well, what about when is it appropriate to transition to a bottle? And I mean, I know from experience, like whenever we brought home our newborns, there was a few months there where my wife would have to get up in the middle of the night multiple times while I slept and got the best sleep of my life.
Well, she's
thanks,
kicking
babe.
you, probably.
Well, now she is. Get
Right.
up.
Right.
It's your turn.
The feeding experience is different for every mom, every parent, every partner, and every baby. So if breastfeeding is something that you are interested in doing and able to do, the Academy of Pediatrics does recommend breastfeeding up for a year, but that doesn't always happen for any number of reasons.
What about pumping and giving them a bottle? Because I know that we were freezing the breast milk, and I'd wake up in the middle of the night when it was my turn, and I would thaw one out, and I would go into JoJo or Austin's room, and there we have it. And then my wife was able to sleep.
Yeah, so we actually did that. I was unable to breastfeed for latching issues, but I exclusively pumped and supplemented with formula because I didn't even make enough milk, but I wanted my kids to have some milk. So I did what I could. Pumped milk is still milk. It's fantastic. Pumping is another challenging experience just in itself, but you get into a routine and you find the support you need. But that milk is still breast milk. It still has all the nutrients and everything that we pass through our breasts still go into pump and then into the baby. So that's a good way to do it. In fact, my husband slept in the basement for the first month and a half of my son's life to feed him. I was exclusively pumping, and I actually had so much postpartum anxiety that I just couldn't sleep in the same room as him because I was waking up so much. So for us, we were fortunate to have enough space in our house and a supportive relationship that he took over the nighttime duties. So I would wake up to pump every 2 hours, and he would wake up and feed the baby the pumped milk. So
having kids can put a serious strain on relationships at times, but it does get better, and I'm having flashbacks, sorry.
Yeah, me too.
So like that waking up in the middle of the night and whatnot, how long does that typically last before parents can usually, and I guess everybody's different, but I don't know, atypical. Is there any atypical time frame?
I don't know if there's
Once
atypical.
they turn 18 and they get out of the house.
I was going to say, I don't think anywhere in raising a kid anything is atypical because.
I need the playbook.
Yeah, right. I think that, in terms of getting your baby to sleep through the night, again, that's a very individual experience. We were able, because I was pumping and we could measure how much milk the babies were getting, we were able to get both of our kids enough milk during the day that by 3 or 4 months they were sleeping through the night.
That's great.
But that doesn't happen for everybody, and that's okay too.
Right.
And I think that you just do what you can do, but your baby may like to sleep through the night and may not like to sleep through the night. Most of them don't, and then you're just like pulling your hair out, which doesn't help with the hair loss either, really.
Right, for sure.
Yeah. But I think that the pediatricians are so excellent in their recommendations that they can answer all kinds of questions about what's normal about the baby specifically, what to expect in terms of sleeping and everything like that. But I think that we have to, as mothers and as partners and parents, not put so much pressure and expectations on ourselves to get it perfect, because there's really no perfect in terms of parenting.
Right.
You do your version of it, and hopefully one that works for you and your family. But we just have to not hold ourselves to such a high standard that we can't reach it, and certainly not the Instagram standard, because Instagram is not real.
Unless you're watching this on Instagram, of course, then it's very real.
Instagram is fantastic.
It's great. You're screwing up my algorithm, Alexandra. Well, I think what I'm really hearing and what I've experienced is that we're all kind of figuring it out, and that's what they don't tell you, as you're growing up, coming of age, having children, is that we're all just figuring it out, and there is no playbook, there's no handbook that works for everybody. But the good news is there's a full team of supportive staff and professionals here at Aspira Health that are willing and able and would be grateful to have you as their patient and help you navigate the world of childbirth and
Right.
before and after.
Right.
Okay, well, that's a mouthful. Well, thank you so much
You're
for
welcome.
taking the time to answer my questions and have a little fun here.
Yeah.
Well, that's all for now, folks. Have a great day and schedule your consultation with Dr. Alexandra Cox. Take care.